We are starting today the series on developing tools for healing. Psychoanalysis is a extremely tool deficient area. One of the reasons is, or rather was, or has been, psychoanalysis developed in a environment of 5 sessions a week. And because the patient was coming every day, there was no situation where between 2 sessions, the patient would have time or there would be a necessity to ask the patient to do something for himself. So working on oneself outside of the session was never really an issue in early days of psychoanalysis. And this tradition continued, although the environment changed and slowly we came down to twice a week from 5 days a week. But the tradition has continued and we continue to be an extremely tool deficient area. Contrary to psychoanalysis, CBT is, relatively speaking, more inclined to developing tools. On the whole, however, if we look at the entire realm of Western psychotherapy compared to its Eastern counterpart has always been a tool deficient area. In the East, what has always existed is a combination of spirituality, philosophy, psychology, mysticism, and holistic healing. A combination, a package of it, and not something distinct like psychotherapy as it is in the West. Eastern counterpart, therefore, has always been an area of tool abundance. Western psychotherapy, relatively speaking, always has been tool deficient. When I refer to tools, I am referring to tools that can be used by the therapist during the session. Tools supervisor can give to the therapist. Tools the therapist can give to the patient to work on himself between the 2 sessions. Tools which the patient can deploy in association with others. Tools which others can administer to the patient. And tools which are based upon technology that the patient can use in a do-it-yourself mode. And lastly, tools which are group tools. And even after that, the last one, tools of immersive experience. And lastly, one more, tools of holistic healing and holistic lifestyle. If you look at this entire canvas of tools, this entire basket of tools, this is an area where psychoanalysis traditionally has been extremely deficient. And this creates a situation where most therapists, especially young therapists, they get into a situation where they don't know what to do by themselves. This may have to do with their own difficulty in theoretical background. This may have to do with their own limited capability in technique, or this may have to do with their lack of exposure in other schools or holistic healing. So in this series, we are addressing this difficulty of tool deficiency. And today we begin with the first tool, which can be used to address the problem of reality acceptance. So let us go into this first tool of reality acceptance. I have titled the tool Lemon and Mango. So let us go into the story of lemon and mango. Reality acceptance is very important in psychotherapy, regardless of which school you practice. In psychoanalysis, this becomes very important when we see the patient entangled in what I call a tragic holding state, meaning a state where the patient is suffering but has somehow survived and may have been able to keep up a profession and even nominally advance in the profession. Reality acceptance may have to deal with areas of accepting something in the areas of finance, relationships, people, one's health, state of affairs in the world. It can be reality acceptance related to anything. Today, we'll focus upon one particular aspect of reality acceptance, that is, accepting reality related to a person who is letting you down and not changing the way you would wish him to change and continues to create trouble for you. Often, this is the situation between husband and wife, where one person is being hurt by the other, not being understood by the other, and the victim keeps hoping against hope that the tyrant will reform himself and become a good object. It is like banging your head on the wall, expecting the wall to give you way. And the same thing keeps coming up again and again in therapy, that X has hurt me, and that is leading to a series of psychological events. And much of therapy then goes in healing or managing those events. And this cycle keeps repeating, with therapy getting almost into a perpetual maintenance mode, never reaching at the root where perpetual change, lasting change can be attempted. So in this situation, therapists are often trying to find out what to say to this patient, how to hit the patient so that he is jolted for a moment into awareness and he gets out of that repetitive tragic situation where he almost is proceeding half drowsy, half awake. How to awaken him to his own futile, repetitive thoughts and actions. So this is the tool for that. The intervention therapist can make is this. The therapist can say, You can't squeeze mango juice out of a lemon. No matter how hard you try, how often you try, whatever technology you use, you can't squeeze mango juice out of a lemon. You have tried doing it for years and it has not worked. And if you can continue to keep doing it for same number of years again, and yet it would not work. You have to accept reality that the person you are dealing with is a lemon and not a mango. And you can't squeeze mango juice out of a lemon. How long you take to understand this is the duration till which your suffering will go on. And the choice is yours. Would you like to accept reality, or would you like to accept continuing suffering? Only you can decide. This is something which is a tool which we can use, that you can't squeeze mango juice out of a lemon, and the only way out is to accept that you're dealing with a lemon and to give up all expectations of extracting mango juice from it. And this will lead to mourning, sadness and mourning, because the person will have to give up denial and accept that he wanted a mango but he has landed with a lemon, and there seems to be no way out. So the only way out would be to accept the lemon as a lemon, give up expectations of a mango, and then think what best can be done given what the given is. So this is the first tool, and this is something which is not only for patients but for all of us. We all are into this situation of trying to extract mango juice out of a lemon. It can be with our parents, it can be with our friends, our lovers, our spouses, or from somebody in the professional world. And it's difficult for all of us to clearly accept reality, because that means giving up our hopes, a sense of excitement that the hope brings, and accept our tragedy and undergo the mourning process and start all over again, which is not easy to do. So this is tool number 1, lemon and mango. Do apply this tool and let me know what effect it takes and how the story goes ahead. Thank you.